Bionox is motivating wellness. Welcome to this edition of Motivating Wellness with Dr. J. I'm your host, Jay Wilkins, and as always, we would want to interview individuals that in their own right, they are motivating wellness as well. And that is definitely true of our next guest. Our next guest is Dr. Tobi Jeurink of the Jeurink Family Chiropractic and Wellness Center. And so we have a lot to cover with her. She's going to tell us about her practice and the things that have been helpful and supportive. And so let's just get a little bit of background on Dr. Jeurink. She was born and raised in the small northeastern town of Ray, Colorado, the beautiful state of Colorado. She grew up battling arthritis and autoimmune conditions and learned early on that the most effective medicines are ones that really deal with not just symptoms, but help you to truly improve your health. She attended Pittsburgh State University in Kansas and graduated with a bachelor's in biology. Then in 2001, she graduated from Cleveland Chiropractic College and shortly after purchased a chiropractic clinic in Garner, Kansas, and a lot of other credentials and things that she's been involved with. And we're going to be able to see what that's all about as we go along. So Dr. Jeurink, welcome.
Thanks, Dr. J, for having me. I appreciate that.
You got it. So let's get right into it. I think a great place to start, as with most individuals that are involved in integrative medicine, they usually have a personal story that makes them go a certain direction, and they speak to that with conviction, and they have their own journey. So if you don't mind, explain to the viewers your personal health journey and your take on how natural medicine changed your life.
Yeah, as my bio kind of indicated there, I grew up with an couple autoimmune conditions. But basically, I grew up being diagnosed with ankylosing spondylitis after having a lot of back pain as a very young individual. My first memory is even a camp at 5 years of age and not be able to sleep on a cot because it was too painful. And so by the time I was finally diagnosed as ankylosing spondylitis, of course, at that time, that was back in the 80s and 90s, where the thought process was that you're probably going to be in a wheelchair by the time you're 40 or 50. And so that did not set well with me, even at a young age. So even then I started kind of looking at options. Fortunately, we had a good chiropractor in our area that kind of kept me in line and explained a little bit about nutrition, but he wasn't an expert himself, but he kind of gave me some direction. And then I I still battle a little bit with Hashimoto's. And then it wasn't until finding the DabC program in the early 2000s that I realized I actually had celiac disease. So yeah, that whole autoimmune cascade, a lot of people don't realize that if you have one autoimmune disease, you're more likely to have 2 or 3 autoimmune diseases. And I definitely fall into that clinical picture. So it's with, finding chiropractic, of course, but then especially when I found the DabC program, that was really a life changer for me. And then even at the time I was practicing, so for a lot of my patients, for us to kind of take a different look at things.
Really cool. So we're gonna deep dive into some of those things that you mentioned there, because the key thing that I love about what you say, though, is now that what you're able to convey is to your patients is that they don't have to be stuck with a disease, and they don't have to go a route of just trying to palliate these symptoms, but there's true hope. There's a way to really overcome. So
yeah, especially with autoimmunity, it's if we can get to literally that root cause and what the triggers are, it's not just about managing blood levels. It's more about, figuring out what we can avoid in our life and what we can improve in our life. And really it's, again, there's so much hope. And even going through, chiropractic school, going through, we learned about conditions. And a lot of times we did learn about some of the things, but it's really the DabC program where we learn those triggers and we learn, really what actually is the underlying cause of these different things and how we change that in the body.
Nice. So when we're talking about causative things, and we're going to kind of build into that, but tell us about some of the lab work that you use in your practice that are great tools for you.
Yeah, we do a lot of food sensitivity testing. We know about the importance of that with celiac and looking at the way that gluten affects us from that standpoint. And that small town I grew up in was also my family's wheat farmers. And so understanding the fact that very early exposure, chronic exposure to wheat on top of a lot of antibiotics is kind of the onset of that. And so we see that now with a lot of our patients that if we can get to the root problems with the gut, what's going on there, what foods are being exposed to. So we do a lot of food sensitivity testing. We do a lot of stool samples as far as, again, because what most people don't realize and what's not taught about autoimmune disease, we're not just born with a gene. We're born with a gene, but then there's certain things that happen in our life that turn that gene on and off, kind of trigger that signaling effect of that gene. And so if we can get to those individualities, those things that trigger that on and off, and especially, I teach dermatology, and we talk a lot about not only do we have the internal stuff that comes on, but our skin and our gut go hand in hand. But if we can understand what's going on in the gut through stool sampling, through food sensitivity testing, we can stop the progression of a lot of these conditions. And if we really know where that immune system starts, and it's in the gut. So that's where we really concentrate a lot of our testing. Of course, we do basic labs along with that, nutritional deficiencies, a lot of other things too. But if we don't get to the root cause of that gut issue, then we're not going to get to underlying other problems too as well.
Absolutely. Yeah, it's a major, can be a major fire going on in the gut. And you got to be able to deal with that, which again, we're going to let you comment on that more as we progress here. So what would be the type of patients then that come through your door that you attract?
Yeah, definitely the autoimmune, and it's not the only ones, but a lot of times people don't even realize they have an autoimmune condition going on, or they're already starting to develop it before we actually get it diagnosed. So that's kind of a big one. We see a lot of kids having learned how mine progressed from a lot of sinus infections and strep infections, ear infections as a young child. If we can catch young kids very early, and from the breastfeeding to how they're breastfed, to how they handle infections, to how they what foods are first introduced, and if we look at their genetics along with looking at those early on infectious and food exposures, if we can catch that very early, then we're able to kind of stop that cascade. It's interesting that a lot of times, I see a 30 or 40-year-old patient with this sudden onset of RA or sudden onset of something. And they say their history goes back, well, yeah, my mom told me I had to be on a formula as a kid because I was allergic to dairy, but I grew out of it. And I'm like, no, you didn't grow out of it. You manifested a different symptom later on. So that's kind of the patients we attract, is 10 of those patients that really have maybe either had a real chronic problem for a long period of time, or they kind of have that acute flare up or that acute onset. They don't realize that, what's really been going on has been manifesting for years. So I do have a little bit of specialty in pediatrics. So we try to, like I said, really catch those kids early. And even, and when we come in and see a kid even for chiropractic, we'll go through mom's history, because a lot of times her history of antibiotics, her history of gut issues, it's going to manifest in eczema. It's going to manifest in seborrheic dermatitis, or what we call cradle cap. We're going to start to see those iron deficiencies in kids that cause sleep issues. So a lot of times, that colic or that early on issues with kids, we can kind of see what's going to happen if we don't get that corrected.
Yeah, so true. That's when you want to see them, isn't it? Really, anyway, is when they're young. And I'm sure your experience is that when the younger they are, the more they rebound, the quicker they rebound, I should say.
Yeah, definitely.
They
haven't had years of damage.
Right. And usually, as unfortunate as we know, emotional factors are such a huge component that the older they are, the more those things stack up too. Yeah. So absolutely, that's really cool that you work with the young ones like that. So how does what you do outside of dealing with the causative factors of nutritional gut type things, how does chiropractic kind of tie into that?
Chiropractic is amazing. And, going through, chiropractic school, and again, especially not knowing what I did going through chiropractic school, and knowing that, I was there because I had been in pain most of my life. So there's a lot of things we can definitely do with that. And so I love chiropractic. And again, sometimes we'll get some criticism by some of our colleagues but we're doing all this metapractor and nutritional stuff. But really, it's one of those things, if we don't have the nutrition to restore the nervous system function, all those amazing adjustments that's when you have that patient that comes in 10 times and their colleague asks them, why do they have to go to the chiropractor every other day, or why do they have to go every week, and they never seem to get better. They're not holding their adjustments, those types of things. So as much as I love chiropractic, it sets up the nervous system to get those right pathways. But yet, if we don't have the nutrition to support those pathways, that's why I really feel like we've got to have both of those. And so it's a big part. But again, I think sometimes the nutrition gets negated in some of the traditional chiropractic practices. So
yeah, that's good. That's a true holistic view, isn't it, to deal with all those different areas, and they all support one another.
Yeah.
So
like I have my car getting aligned right now, but I'm also having the oil changed. And so if we think about it that way, we don't usually do one without the other, because both parts of the car are important, just like the nervous system relies on the gut and back and forth for us to be able to make those things work.
Good deal. Cool. Well, so we know that you mentioned a few times or I think we did, about DabC. So that's kind of an interesting acronym. And that's, of course, we met through in Denver there, right at the height of the pandemic in 2020 in March. And the year before that, I was able to go to the one in Nashville. I assume you were probably there as well. Yeah. Yep. So it was really nice. That was my first exposure to DabC. Great group of individuals, very serious, very intense speakers that really dived into the biology and such. So tell us a little bit about DabC.
So DabC is the Diplomat of the American Board of Chiropractic Internists. And I wish I knew the exact date in history when it started, because we have some great legends out there that have been part of the program for years. And so it basically is taking the core philosophy of chiropractic, which is looking at what we call dis-ease instead of disease, right? So we're going to that functional standpoint of finding out where things went wrong. So we apply that to chiropractic, and as far as looking, pelvic alignment, looking at when we had that fall, how did that change the nervous system? But again, we apply that with internal medicine as far as being able to look at where that went wrong. Did it start with the celiac, or did it start with that infection? And going back to that root cause and kind of applying that. So that's kind of the core concept. But I love the fact there's a lot of excellent functional medicine doctors out there, but I think applying it from the chiropractic side of it is our philosophy goes really back to that dis-ease. And unfortunately, a lot of times on the medical side of functional medicine, they've learned kind of the whole medicine side of stuff, and then it's kind of hard to relearn that idea of dis-ease, right? So they learn to diagnose and treat with a medication or a surgery, and not, again, that sometimes that concept is new to other providers, that there's that core cause in the first place. So that's what I love about, because a lot of our students ask us, what functional medicine program should I do? And I have to tell them it's the DabC, because it falls in line with that core concept of chiropractic.
Yeah, very cool. Yeah, I was really enjoyed being with your group, and we'll continue. Going to be at an ACA meeting down in Florida. I know there's a close affiliation with the ACA and CDID, and so that'll be a nice, smaller group. But can't beat Florida. Be nice to get back there.
Yeah.
So look forward to that. So tell us a little bit about the nutritional testing that you do, and sort of how that looks and what that's about.
Yeah. So like we talked about, a lot of it has to do with gut, ALTA, or some of the food sensitivity testing, some of that type of stuff. Also basic nutritional testing, B12, folate levels, micronutrient levels. Unfortunately, in this country especially, we're one of the few areas where you can be obese and still be nutrient deficient at the same time. When we have a very calorie dense diet, but we don't have a nutrient dense diet. So that's a lot of what we're looking at to see. And then, but not just from the standpoint of here, take a vitamin because you have a B12 deficiency, but let's go look, is it because you aren't taking in the right foods, or is it because you're not absorbing the right nutrients? And again, that goes back to inflammation in the gut. So yeah, we do a lot of the nutrient deficiency type of testing. We do, again, a lot of the inflammatory type markers. We're looking at cardiovascular disease. We're looking at diabetes. looking at insulin levels. And there's a lot of markers that we can see long before diabetes is full-blown diabetes. We have insulin resistance years, sometimes 10 years before that. So if we can catch it in insulin resistance, someone never has to actually develop diabetes, no matter what their genetic markers say, no matter what, what's going on. If we can change that lifestyle at the very beginning of that, we don't have to have that progression. So that's really what we try to do. Obviously, we catch a lot of people in that alarm stage, in that putting out the fire stage. So unfortunately, some people are at that diabetes stage when we start to work with them. But for other people, if we can really do that yearly prevention workup and say, hey, your insulin's creeping up. We just did a DOT physical yesterday, and we have to do a urinalysis. And that urinalysis had a little bit of elevated blood glucose, right? So, someone that hasn't had a physical except for every 2 years for a DOT, we're able to take some of those easy markers and look, let's look a little bit deeper, and let's make sure you aren't starting to develop sugar problems, or let's make sure something else isn't going on. So from the very basic screens of a UA all the way to the really advanced screens when we look at autoimmune markers and look at, again, stool samples and things along that line.
Yeah, that's really good when that's something unique to your training, is to take lab work and look at little things in there that may not be a flag to maybe a conventional doctor, and say, let's work on these now, and see how you're going to feel amazing, but then also we're going to put you in line to be much better down the road and much healthier.
Yeah,
so,
a lot of times we have patients that walk in, they've been to a health fair, they've gotten labs from their doctor, and the doctor said, you're fine. And they bring in their lab, and there's 5 markers that are out of not even our what we call functional range in the DabC program or in the functional medicine program, but their patient can see, the doctor said, I'm fine, but these labs are not normal. And so we're able to kind of take that and put a perspective. Yes, you're fine from the standpoint, you don't need a medication yet, but something's going wrong in your body, and let's put a stop to that.
Yeah, very good. So I know every practitioner, they have their favorite stories. I know I have mine, and they're really cool to see the progression, where they were and how far they come. So I know you do as well, being as practice, as long as you have been, and the type of modalities that you're using. So share one or two with us, if you would.
Yeah, I guess, there's definitely a lot of them. I'll start with one of my first DabC cases when I was still in the program, still going through, and DabC is a 300-hour program plus continuing education every year. First going through the program, one of the first cases I saw and did a stool sample on was a young boy who was 7 years old and had very severe eczema. He had eczema since he was about 7 months old. And you can imagine, in 6.5 years, he had been to, many providers. He's been to dermatologists, he's been to medical doctors, his mom had tried a lot of different things. And not once in those 6 years had anyone talked about his gut, because he never complained of stomach aches. And again, teaching dermatology, the gut and the skin are, hand in hand. And he had huge inflammatory markers. In fact, the lab called me and asked me if he had inflammatory bowel disease. And I go, not that we're aware of, but he has no stomach complaints whatsoever. And he had huge amounts of food sensitivities. And within 6 months, after going through this for 6 years, we were able to clean up his gut, do some repair processes, get him off some of the inflammatory foods that showed up on the food sensitivity testing. That was probably about 13 or 14 years ago. And to this day, his mom still kind of cries when she sees me, because, she went through 6 years of this with him. And luckily he was able then to go through junior high and high school and, and the rest of his schooling without having to fight this very severe eczema. So, from a very young age. And then one of my other favorite patients is the opposite end of the spectrum. And we say it's never too late. It's never too late. She's in her early 80s, and she was having some very severe skin reactions. It's what she'd been a dermatologist. She corticosteroid creams here, creams there, and she did some reading on her own and did some Googling at 80 some years of age, and found out that dairy might be a culprit, and then found us through some of that. And not only were we able to clear up her skin condition, but she lost 30 pounds. the arthritis that was bothering her in her shoulder, she was now able to actually lift and move and do things with her shoulder she hadn't been able to do for about 3 or 4 years. And I tell you, she's a walking billboard for, I mean, she walks the walk and talks the talk. And so when people say they can't make changes, I say no. And we actually schedule her, 30 minutes early so she can sit and talk to some of our other patients. Because she's just amazing that she made those changes. So
that is very cool. And I like how you did that with the two ends of the spectrum there of age groups. But I think the key takeaway too is that here they came in for skin issues, but what you didn't even really talk to them about their skin. You went to the fire and went to put out the fire. And as we know, the symptoms kind of take care of themselves, don't they?
Yep. Yeah.
Really cool.
Join Dr. J next time with Dr. Tobi Jeurink in episode 2.